Hello, Dr. John here again, here to talk to you a little bit about the different things that arise in your life, different problems you might see over the course of time, and that people oftentimes associate coming to a chiropractor for. So today I'm going to talk about shoulder problems. And shoulder problems can mean a lot of different things to different people. For me, the whole shoulder complex involves making sure that you have the proper relationship between your spine and your extremities. You know, your body, when you develop in the womb, doesn't develop from your hand to the spine. You develop from the spine and the brain outwards towards the hand. So when we approach any problem with an extremity, we always look to the spine first. The shoulder, for example, gets its innervation, direct innervation, from the lower neck vertebrae and the upper back vertebrae. So we have to make sure that the lower cervicals and upper thoracics have freedom of motion and are free of nerve interference. That being said, we must always address the upper cervical area. This is the major circuit breaker. If this is out of balance, no energy will flow. Shoulder issues can also stem from things in the pelvis. Pelvic instability can cause compensations and involve muscles to perform roles that they're not usually involved with. So shoulder issues can also evolve from the low back. So again, when we check you in chiropractic, we look at you as a whole person, not just where you're hurting. Now, the shoulder itself is 4 joints, believe it or not. Most people relate to the shoulder as being, you know, the ball and socket. But it's also where your collarbone meets your breastbone. It's where the collarbone meets the wing bone, also the scapula. But it's also how your shoulder blade glides on your rib cage. That's called your scapulothoracic joint. So it's almost like a suspension strut system in your car. It's a linkage, if you will. Every joint has to play a role in the movement. Oftentimes with frozen shoulder, it's not the ball and socket that's involved, it's the shoulder blade that doesn't move. So it's complicated, but you do what the body shows you and you figure it out. But the underlying thing we have to address is nerve interference, the subluxation. Some people complain of shoulder issues, just pain along their spine by their rib cage and their shoulder blade. That's coming from the neck, and we need to address that. So the shoulder's complicated. The price you pay for all of this motion is that it's relatively less stable than your hip, for example, which is a deep, bony socket. The shoulder socket is very shallow, and it relies on a lot of soft tissue for its mobility and its movement. So the price you pay for that, it's more susceptible to injury. So as we address your shoulder issues, we're going to look at the underlying cause, which is nerve interference and joint function, but also get you doing exercises to strengthen your shoulder area, especially rowing movements where we retract and squeeze our shoulder blades. We forget that we have shoulder blades. Our lives are so much into pronation of our shoulders and forward leaning that we forget that we have back muscles, and we need to strengthen those. Okay? A lot of guys do too many bench presses in the gym as well and neglect their back training. So you want balance in your training, you want balance in your spine, and you want to be free of nerve interference. So again, we're going to start at the spine and work to the extremity, not at the extremity and work to the spine. This is a chiropractic office. We deal with nerve interference first and foremost. So I hope that helps you.